Hi, everyone. TJ Alt, I-45 now, and welcome to another edition of What You Need to Know with Dr. Philip Keiser, the local health authority for the Galveston County Health District, is on with us this afternoon. And I should point out, too, some information that came out Friday. Also, Dr. Keiser, you're now the interim director of the Galveston County Health District, as well as chairman of the of Coastal Health and Wellness. You may want to explain that to folks there who may not have seen the announcement that came out on Friday, as if you weren't busy enough as it is right now.
Right. So, the CEO, Kathy Barroso, announced her retirement. And, this is something we're seeing all over the country, where this has been a very grueling year. And a lot of people are worn out and tired, and people are looking at their options and saying, well, it's ready for me to retire. I'm ready for me to move on. And so this is a good time. So she decided to do that. And then I was asked by the board to be the interim director of both those organizations. It changes things for me, but we're still going to focus on what we've been focusing, which is getting people vaccinated and trying to put COVID to an end. So that's still going to continue to be what I focus most of my efforts on.
Which gets us into the big questions right now as it relates to COVID-19, and is that are enough people getting vaccinated right now?
Yeah, and the short answer is no. We went through the group of people that were really anxious to get it, and we had a lot of demand for it. And in fact, we had so much demand, we not only couldn't accommodate everybody, but our websites were crashing and our phone lines were crashing. And, we worked through all of those issues. But now what we're seeing is that fewer and fewer people are interested in getting the vaccine. So now's really the time to get the vaccine. It's actually a good time to get vaccine.
And what do you attribute that as you said beforehand, we had long lines, people really looking and the like. I saw a national statistic this morning that at least 50% of the country has had at least one shot of a vaccination that's in there. What do you attribute to what would be, I guess, the saturation or slowdown that we're seeing right now?
Yeah, well, we knew that 50% mark was going to be a barrier, because we polled our employees, we polled people in the county, and basically about half the people said they really, really wanted it. Of those left, about half of those were, think about it. I think I might want it, but I'm not sure. And then the last 25% were just saying, no, we don't want to get the vaccine. That's okay, because if we can get 75% of the people vaccinated, we think we'll be in a really, really good spot, and hopefully have reached some sort of herd immunity, or at least have the levels down low enough that it's not a big problem anymore. So we were expecting this. And in fact, we've actually been watching this almost every week for about the past 5 or 6 weeks. Initially, the state said, we want you to vaccinate everybody over 75. And it's like, well, we don't have enough people left over 75. And then it was 65. And it's like, okay, we did that. And it's like, well, we don't have enough people left on our list. And we just kept going down, and until we got to the point where it was open up to everybody. And we were thinking we should open it up to everybody before the state gave us the permission to do it. And that's because there's about half the people really want it, and about half the people either don't want it or aren't sure. And so we have a difficult task trying to convince those people who aren't sure to address their concerns, or to figure out how to make it easy for them, or to get in their communities where they may find it hard to get the vaccine. And that's what we're working on very actively right now.
I found it was kind of interesting, and this goes into kind of a bigger question maybe, too, is you may have seen this yourself, that some nurses at Methodist in Baytown, the Houston Methodist has required that all of its employees, particularly those working with patients, be vaccinated by June 7th. Mm-hmm. Requirement to work there. And I wonder, though, too, is that where do you stand on the fact that healthcare workers particularly need to be required to be vaccinated?
Yeah, well, I wouldn't go so far as say required, but I do think that healthcare systems should make it easy for the healthcare workers to get vaccinated, and quite frankly, put a little pressure on those who are not to get vaccinated, because they're in such a vulnerable position, and they also can transmit the virus to patients who are very vulnerable. So we're really worried about that. But the bottom line is that this still is not an approved vaccine. And every year we have healthcare workers that are not willing to get the influenza vaccine. So this is not a new situation for healthcare entities. So, and then you add on top of that the fact that the governor's order basically says that for the state of Texas, state entities will not require the vaccine. So, we're taking a point of view. We're trying to encourage everybody to get the vaccine. We want everybody to get it as quickly as possible and as much as possible. And we get to a point where people don't want to get the vaccine. Don't be surprised if you find yourself in situations where you're the one that has to wear the mask and other people don't. It may just come down to that. And we'll see how it all plays out.
Oh, and then it comes into now is that I had someone tell me this the other day, and I thought it was kind of odd. She says, well, I can't find a place to get vaccinated. And I found that kind of odd. And maybe it's because I'm having this conversation with you every week, and I know the availability out there, but just how available are vaccines right now?
Yeah, we have plenty of vaccine. We have so much vaccine, we're probably not going to order any new vaccine for next week, because we'll be able to meet all our needs for 2 weeks with a 1 week's allocation. And so we don't want to have vaccine backing up in our freezers and then have the possibility that we have to get rid of it in a hurry or send it back. But we have plenty of vaccine. We have plenty of appointments available. It's what's called an opening scheduling system at UTMB. And people can go to the website and click on a link, and they'll find days and times throughout this week where they can get their vaccine. And at the health district, we also have call numbers that people can call and an email address where people can call. We're going to make some changes to the website to make it more available, because I hear the same thing. I have people telling me, I don't know where to get it. I'd like to get it. I actually had a waitress in a restaurant last week asking me, can I get vaccinated? I don't know where to do it. And I wrote down on the back of the check of how she can get the vaccine for her. So clearly we've got to do a better job of letting people know how they can get vaccinated.
I just want to make sure. So you did also tip her, right? I just want to make sure.
Yes, I did. That was not the tip. The tip.
Okay, I just want to make sure. I didn't want anyone to think.
I gave her my usual customary tip for her great service, and then on the back also wrote, "This is where you need to go to get your vaccine done."
Just make sure. And if you are interested in getting vaccinated, utmbhealth.com/vaccine or call 877-389-2318. Now, the flip side of that, I did hear from someone last week. They said I went on the website and I was able to find an appointment like right away.
That's right.
And going in, we heard Harris County started having the kind of what's called on-demand appointments now.
Yeah.
And so now being able to get somewhere to be vaccinated is a little bit easier. So that gets into the Walter Hall Park, which was the first kind of mass vaccination location. Mm-hmm. I understand the decision's been made about when that will be changing up.
Yeah. So we're going to have our last event there on May 1st. It'll be primarily second vaccines. And then anybody who got their first vaccine will be told where they can go to, a facility to get their second vaccine. But, the whole point of that was to vaccinate as many people as we possibly could in a short period of time. And from that point of view, it's mission accomplished. We put tremendous time and effort and resources into getting that thing up and running and to keep it running. And right now it's running extremely well. I wish there was the demand that we could keep this running for another month or so, because that way we could get that other 25% that we want to get and say job done. But it's just, there's not the demand. Last week, on days that we had previously vaccinated as many as 4,500 people, we had 300 people sign up. So we canceled our event on Tuesday and combined that with another one, so we would have enough to justify opening it. We can do 300 people in less than an hour. We initially said we wanted to do 5,000 an hour, and we're pretty darn close to that. But there's just not the demand, and there's just not the need for it. The nice thing is that even though as we step it down, we have something to replace it with. So people will be able to go to one of the vaccine sites around the county. We're also talking with providers who have not been able to get a regular allocation of vaccine. And right now we have a little extra, and we can say, hey, we can give you some of our Moderna. You want to do 200 shots of Moderna or whatever number that is. We'll be able to transfer some shots to other people. And we're even talking about the idea of doing walk-in clinics where people don't even need an appointment. And we haven't quite figured that out yet, but we want to make this as easy and widespread as possible.
Is this also a time, you have mentioned this several times on the show when we've talked about it, of moving to more community-based vaccination clinics with local churches and the like? I know like Barber's Chapel was used last week. Yeah. You had something also at the convention center last week in Galveston. Is that what we're probably going to see more when there is those kind of mass? It's going to be kind of pick a community, and when you found a partner to work with to do that now, is that where we're probably headed right now?
Yeah, that's exactly where we're headed right now. So we want to make it so there you can go to a clinic and you can get it, or we're going to be looking at communities where a need has been identified, either from our point of view as we look at where vaccines have been given and where they haven't, because we can track that, the parts of the county where they haven't been given. Or if people come to us and say, hey, can you vaccinate my group? I got a call last week from a friend of mine. He teaches a Bible study class at a church for 30 men, and he wants us to do them as well as their spouses. And it's like, sure, we can do that. So I think that's what it's going to look like. But the other thing to keep in mind, we may see some big efforts again as vaccines become available for children. So our goal is to get as many school children vaccinated prior to the start of school in the fall. And as soon as the FDA gives us the go-ahead, we're going to be working on that, and we are having meetings with the school districts to talk about how we would accomplish that.
In fact, we have someone pointing out that Praise Chapel, which is located on State Highway 3, they're going to have 300 vaccines that they're making available. So we're seeing more and more of those kind of partnerships. I know. We got a question from one of our viewers. Well, it's Doreen again, and Doreen's great. She asks questions every week. She says, my son's appointment at Walter Hall got rescheduled from 4:23 to 4:24. He has a prior commitment for that morning slot. He's been assigned. Can he just go a couple hours later that same day?
Oh, absolutely. No problem. And particularly, the only thing I would say is don't wait till the end of the day, because they might count him as a no-show, So if it's a couple hours later in the morning or early afternoon, it'll be fine.
Gotcha. The other it gets into now the community based. You mentioned about the gentleman who said he had a men's club and doing that. I wonder though too is that maybe what it gets that last 24% is kind of those smaller groups where, well, because everyone else in my group's going to do it, now I will go ahead and get vaccinated too. That they feel more comfortable in a setting they're already in. You've mentioned this a couple of times, that folks will feel better and not necessarily driving to the park or going to a clinic as well, that they would feel better just going in a setting they're already comfortable with. That's part of it too, is it not?
Oh, no, it's not just a setting in which they're comfortable with, but also people with which they're comfortable with. One of the things that we learned as we started going out in the communities, we would have people walk in who were brought by their friends. And that person on their own would have never done it. But their friend said, hey, I'm going to get vaccinated. Why don't you come on with me? And we found that that's very helpful. It's also, who do you trust? People don't necessarily trust the government. They don't necessarily trust me. They don't necessarily, trust all of us that are saying you need to get their vaccine. But on the other hand, if their pastor or a friend of theirs in some organization, whatever it may be, says, I think I'll do this. Why don't you come do it with me? That is so much more powerful. So if you're thinking about getting a vaccine, please do, and bring a friend with you. You'll do both him and yourself a lot of good.
Yeah, it's a smart move. Bradford Metris has this question. I have an appointment for 5/1, May 1st at Walter Hall Park. Will the site be available to me? Yeah, Brad, that is the last day.
Yes.
Of that to go through. Now, most of them are going to be second shots, correct?
Right. At this point, most of these are second shots. In fact, starting this week, we've stopped doing first shots at Walter Hall Park. And so that's because we don't have, when we do a first shot at Walter Hall Park, that means we have to figure out what to do with people 3 weeks later when it's time to get their their second shot. And so the numbers, people wanting first shots is much lower. We're talking about, thousands in a week instead of thousands in a day. And so it's much easier then to say, okay, fine, you had yours at UTMB at League City, come back in 3 weeks, or you had yours at the health district, come back, to spread it out. It's not nearly as time intensive. It's not nearly as labor intensive. And it's time to move on. The park did its job, mission accomplished. We vaccinated a lot of people. And but now we have to try different methods and try things that'll be more effective.
And I know a lot of folks are going to be glad they can get the park back.
Yes, absolutely.
Recreational activities too.
Yeah, I hear it's a great place for Pokemon Go. So
yeah. Deborah Simmons wrote this. I received first vaccine in Texas City on 3/29. When will the second shot be available in Texas City? That should already have an appointment set up correctly after you get the first vaccine.
They should have an appointment set up, and if not, there's a number that you can call right now. It's available from 9 to 5 on Monday through Friday. So go to the Galveston County Health District website and get that number to call. We're going to be changing that a little bit so that there's after hours calls available and weekend calls available. And we're also going to be changing it so that people can email in and we can get back to them. We recognize that there have been some problems in people getting through and confusion regarding second doses. And the more we move along, the more people there are who have missed their second dose, either because, something happened and they couldn't get to the appointment, or something happened and we changed the appointment and they didn't get the message. So, we're encouraging everybody that if you need a second shot of Moderna, go ahead and call the health district up. If you need a second shot of Pfizer, go ahead and call UTMB up. The health district doesn't have the Pfizer vaccine, but we're going to do everything we can to get you in and get your second shot.
In fact, let me pop that up now. The number to call at the health district is 409-938-7221 is the number that the health district is putting out there, 409-938-7221. Just pulled it from the site there for you able to follow through. And more likely that viewer had the question was if it was in Texas City, that's going to be a health district there. We've been hearing a lot, and this goes into close to the next question. People are worried about what they call the BB1 COVID variant found near Texas A&M. A little too close to home. That's from Stan Van Horn. You had said last week you wouldn't be surprised if we find a Galveston variant at some time. This is the real concern now, is the variants. Is it not? Because the UK variant is what's dominating right now as far as the positive cases, correct?
That's right. That's right. And, and there are local variants that have been floating around, not so much identified here. Well, let's put it this way. So the Galveston National Lab regularly takes a sample of all the positive tests and samples them. And I can't say anyone has identified a unique variant just to Galveston County, but it wouldn't surprise me if we have one to our region. I mean, there's now a Colorado variant. There are 2 California variants. Fortunately, most of these variants do not change things substantially. The nice thing about the UK variant is the vaccine still is active against it. The Brazilian variant, the vaccine is still active against it. Our virologists are concerned about the South African variant, which has been found in the United States and in Texas. And what will happen with that? Because they're not sure that the vaccine will be enough to hold it in check. What that may mean is that we may end up doing a set of boosters for people come the fall. And that if that were the case, there would be a slightly tweaked vaccine, almost certainly an mRNA vaccine, because they're easier to tweak. And it would cover those variants. And then we would just line everyone up again and say, okay, it's time to get your booster. It all depends on how much vaccine we have and what the demand is. It may be something as simple as going to your doctor and getting the booster. That would be the ideal situation. But the good news is that if we have to do something where we have to do mass drive-throughs, we've got that. We know how to do it, and we could probably stand that up very quickly.
And that goes to the question is going to Bradford asks again. So is there another test for a variant, or will the COVID vaccine cover it? I think what we're talking about is that if you have COVID, no matter what the variant is, the testing is going to still show positive for that.
That's right.
It's what comes afterwards. It's kind of more detailed testing that's done of that positive test that comes up.
Yes.
And then Charlotte Boson is asking, says, need a variant new shot. And that goes into something you and I discussed the other day about before doing the show. Let me first get you to explain what is a variant, because it is the baseline, still the COVID-19 virus, but there's something different about it. Can you explain what a variant is in kind of a simple terms for folks?
Sure. The most simple way to think about it is that it changes the virus's genetic material. So it changes the RNA and the DNA so that there's one little substitution in there that happens that the original thing gets replaced. And that's because the virus doesn't have the ability to what we call proofread. So in our bodies, when our bodies make new DNA, the machinery goes back and says, oh, there's a mistake, takes that bad piece out, and puts a new one in. Viruses can't do that. When viruses do that, most of those things are either harmless, i.e. they make very little difference in how the virus lives or responds. And then many of them make the virus less effective and kill it. But there's some that give the virus a little bit of advantage. And this particularly occurs on what we call the spike protein. So you have the virus and then you have this protein that sticks up. And that spike protein is the part that actually hooks into the nose and allows the virus to get inside your cells. So when someone has COVID, or you get sick and you're worried you might have COVID, or someone told you, gee, I've had COVID, you need to get tested. They stick the swab up your nose, and then that swab gets tested in a machine which actually recreates the entire genetic sequence for that virus. And then they say, yes, we found it, or no, we don't. Now, what happens is some of those individual swabs are sent to the Galveston National Lab, where they have research scientists then take that sequence from each one of those people. And right now we're doing about 40 or 50 in a week. And you take that sequence from each one of those people, and then they actually see what the genetic mutation is for each one. And so when they do that, they fall into different patterns, and they can identify some that they already know, like, oh, this is what they saw in the UK, and this is what's here in the US now. Oh, this is what they saw in South Africa. And this is in the US now. And sometimes they say things that they don't know what it is. It's just a change. Don't know if it's any different. Doesn't mean a whole lot. So it's a rather intense, labor-intense process, and requires a high level of skill to do it. But we're very fortunate in that we have the ability here to monitor that. Not only do we have the ability to monitor that, then the other scientists are then able to take that virus, that sequence, and recreate the virus, and then test to see whether the antibodies that the vaccines make are active against them. And that's really the icing on the cake. So we can look at those viruses and we can say, yep, the vaccine's still going to work. Yep, the vaccine's still going to work. And right now, in the case of the South African vaccine, they're not saying it's not going to work. They're saying it's not as strong as with the other ones. And so I'm a little worried. That's where we are.
And when you talk about that protein spike, I went ahead and pulled this imagery up here. This is a depiction of that. Those little red things you see on there, folks, that's the protein spike, is like,
that's right.
And around that and that's in fact that's where the RNA vaccines also go and attach itself to that, correct? And basically pumps it through and reprograms it. Is the best way kind of describing things for folks there to kind of understand kind of layman's terms of that. And by the way, this is the same way that the SARS virus was fought, was seeing that spike and being able to do it and identify that and going through there. So just got to give folks that visual of that. And that does get into the question about boosters. Do we need a vaccine booster? And I asked you this question. My personal point was, as I was been studying this and coming through, I said, I wonder, should I be looking at August, September or so to go in and try to schedule up and just get another shot? And because there's always some tweaks going on. And you said probably that's where we're going to be. And after you and I talked, Pfizer's own CEO said over the weekend, that's probably what we're going to do. We're going to develop that and see if we can have it ready by August or September. So that's already being looked at.
That's right.
By the companies who are making these vaccines as well.
Yeah, that's right. And we'll have to see whether we need it or not. But I wouldn't be surprised if that's what we're doing. And, it's like every year we get a new flu vaccine. Well, why do we get a new flu vaccine? Because the flu changes a lot every year. And we need those antibodies to those new flu viruses to help us keep from getting the flu. The good thing about the coronaviruses is that, or the coronavirus vaccines that we have, they are so much better than the flu vaccines. Flu vaccines prevent about 50% of cases of influenza. We got stuff that prevents 95%. It's a home run. It's absolutely amazing. And this technology is going to change the way we do vaccinology in the future. It wouldn't surprise me if we have RNA vaccines for flu, and the effects may even last longer. But we'll see. But again, don't be surprised. It's right now it seems like a huge deal, but it's probably not going to be a big deal. It'll just be, it's time, and you'll get an email from wherever you got your first vaccine, and they'll say, hey, you're due for your booster. Come on in, go to the website, make an appointment, and that's the way I expect it to be at some point.
Or Regina Haley is asking, will the booster be 1 or 2 shots?
Yeah, right now we anticipate 1, but we'll have to see. I'm sure that as they test it, they're going to see what does it take to develop these new antibodies. And it may be just 1 shot targeted specifically against the variants that we're worried about may be enough.
A lot more coming out of this, and it'll lead to the next question on this is a question from Bradford again. And Bradford, really appreciate you asking the questions that you are today. Why does the second shot cause you to feel down after it's taken? Is it different strengths? Just asking because I'm up for my second shot. That's been the concern, and it's been different for different people, Bradford. Let me just kind of warn you. For myself, for example, the first shot gave me a bit of a headache. Second shot, nothing. I mean, I didn't feel anything. But a friend of mine, he was down for the count this past week, and just said, "Man, I'm sick," and he stayed home. He wasn't sick. It was a reaction to the shot. How come, what? So, Bradford, I wish we're going to give you a solid answer here. We just don't know because it's going to be different. But explain why that does happen. I liken it to what my mom used to tell me when she made me take medicine. It says, well, if it tastes bad, that means it's good for you. Or if it tastes bad, it means it's working. Is it as simple as that, or is there another reason there?
No, there's another reason. Trust me, I've given some medicines that taste bad and really didn't do much good, and we regretted it in the long run. But the thing is with vaccines, it has to do with how the immune system works, right? The whole point of the immune system is to remember what infections you've been exposed to, and then to respond to them. So with the first shot, your body has never seen that infection before, okay? So it sees it, it processes it, it develops an immune response to it, and there's something there. And some people, that immune response with the first one can be very little. Some people, it can be more. But when you give that second shot 3 weeks later, the immune system's primed. It's vigilant. It's vigilant. Imagine all of these. Now you're in an armed camp and you have all these sentries on guard, and you get that shot. And what happens is that the immune system starts screaming, there's an enemy here. There's something foreign here. We need to attack, attack, attack. And so as it attacks, it also brings in more troops and trains more cells and makes more antibodies. And that's the part that makes people feel bad. Now, why do some people feel bad and other people don't feel bad? It really has to do with just individual responses. And even in my own family, my wife felt nothing. And for my second vaccine, I felt awful. And I was down for the day, and I took some Tylenol and slept it off. And the next day I felt okay. Yeah. So I tell people, for your second shot, be prepared to take the day off. You may not have to, but just be prepared, and be prepared to take it easy, because it can make you feel bad.
Yeah, in fact, that's what I did. I had made plans, and the next day I was like, "Well, I'm fine. I don't have." So I like this comment from Stan Van Horn. He says, "The Moderna second shot had me down for 4 days. The wife got Pfizer and 0 side effects with second shot. I was not happy with her."
And you know what? I can't tell you it was Moderna that did it to you or whether it's just you. You could have gotten Pfizer and had exactly the same reaction.
Well, and now you say that. In fact, Doreen comes back in and said I had Pfizer and the second shot took me about a day and a half. So,
Yep.
I mean, it really they're the same technology. And you had said this is going to change out things. There's two parts about a vaccine. I think folks may not understand is that the vaccine is actually just helping your body figure out how to fight the virus. The vaccine itself is not what's really going out there and battling it. It's telling your body how to fight that. Correct?
Right. That's right.
Yeah, that's the interesting part about the RNA vaccines, and that goes to the next part. And you and I talked about this 2 weeks ago, but I find it personally fascinating, the technology that exists, and it with this now, and in the more and more, but really, RNA vaccines aren't brand new, but they've been around for a little while being looked at, correct?
Oh, no, they've been around for a long time, for probably, I think maybe as far back as the 90s is when people first started conceiving of them, or the first part of the century. But there's never been an opportunity to try them out on big scale. They thought that they might help with cancer or some other things. And it's all been very, very small. And it wasn't until COVID came along that the decision was made to let's go big with it. And it was the right decision.
Yeah, it's something else. And a lot of times with this type, as it is with, I think, a lot of technology, you need that right opportunity.
Right.
And again, I hate to call it a silver lining, given how many people have gotten seriously ill and died as a result of COVID-19. But the fact that this technology has emerged now is something that is a fascinating to me personally. I think to a lot of folks I've been talking to about, it's one of those things. It's now I actually was talking more in a bar about that than I am sports a lot of times. So when folks and I do find a lot of people come and ask me about that, and I say, well, the good thing for me is I have some experts I talk to every single week about this and go along. Our Chris Tallman has a question. Is if I missed it, do we know any long-term side effects? Obviously, right now, long-term is a relative term because our long-term is really going to be what we know within the short time period. If you think about it, this wasn't widely known available to the public until really December, January, February. So really, we don't know long-term effects, but we are discovering things along the way once it gets into the population of any side effects. What, if any, are we seeing out there? And that'll obviously lead us to the Johnson & Johnson conversation.
Yeah.
So we are seeing some issues with the Johnson & Johnson.
Sure. Right. So for the RNA vaccines, Pfizer and Moderna, we've seen most of the side effects. Keep in mind, even before these vaccines came out, we knew that most side effects that occur with vaccines occur within the first 2 weeks. And in fact, most bad reactions occur within the first 15 minutes. And that's why we have a 15-minute waiting period. And then for people who are at higher risk, a 30-minute waiting period. But, there are some very bizarre, very, very rare illnesses. There's an acute demyelinating syndrome, which occur where basically the immune response from the vaccine can cause an attack against the sheaths or your nerves in your nervous system. And this occurs in less than 1 in a million people. And we have yet to see a convincing case of that in someone who has gotten a COVID vaccine. So far, it's done really, really well. And the whole level of side effects have been extremely low, other than the fact that people have sore arms and, get a fever or a headache or feel confused or what have you. Other than those symptoms that we all know about, there really has not been a real pattern, except for what we've seen with the J&J and the AstraZeneca vaccine with blood clots.
Right, and that brings up that question about what's happening with the Johnson & Johnson vaccine, and you bring it up because it is similar to AstraZeneca, which is
right.
So, just so we can put this in perspective for folks, is that there have been, I think, 6 cases in the U.S. Of folks who developed blood clots.
Right.
Johnson & Johnson. Explain, folks, to us what we're seeing there, and what what data being looked at right now has been able to tell us?
Right. So there have been reports of 6 women, most of them under the age of 50, who developed blood clots, but not just blood clots in their legs or in their arms, but actually blood clots in their brains. And some of these were very serious. One woman died. Another woman is on life support. It's very, very rare. 6 out of millions of doses that have been given so far. But here's the thing that's got everybody worried. One is that it's a very distinct epidemiologic group. It's all women. They're all, between like 20 and 50. They're all in the same place in terms of where the clots are, and they're all very, very serious complications. I mean, I don't want to minimize that. This is something that's very, very serious. What is more concerning is that this happened in the J&J, and also in Europe, they've reported about 8 cases, which are very similar to what we're seeing in the United States. Now, why is that important? It's important because the J&J vaccine and the AstraZeneca vaccine, which they're giving in Europe, are very similar vaccines. And they both use what's called an adenovirus vector. An adenovirus is another cold virus. And so instead of just putting the naked genetic material in you, they put it in this coat of a different virus, and then that helps it get into your cells and helps you get a good immune response. That's the idea behind it. So right now, the real question that's coming up, or I'd say there's several questions. The one is that, is this actually related to the vaccine? We don't know, because people get clots, and people get clots in their head, and it's happened very rarely. So what has to be looked at is, how does the incidence of this disease look compared to the way it is in the general population or in similar aged women who have not gotten the vaccine? If it's the same amount and there's really no difference, then this is probably just what we call an ascertainment bias. We were looking because we were given vaccine and we found these people, and it probably would have happened to them anyway. So that's question 1. Question 2 is that even if it does happen in association with the vaccine, does it happen more frequently than they would get blood clots otherwise? So we know that people who have COVID die from blood clots. They die from blood clots in their lungs. They get strokes. And what's the balance? Is it that there's these 6 here, and then there's all of these blood clots over here? In that case, it would be a reasonable risk, and that's something that has to be looked at very carefully in terms of the numbers. But then there's a third factor that has to be factored in here. And that is, now, as of today, we have safer alternatives. If the J&J vaccine were the only vaccine we had, we would probably still be vaccinated. And we would say, okay, the risk the benefit outweighs the risk, and the risk of dying from COVID is much greater than getting a stroke or a blood clot in 6 people. And we would go ahead and do that. But because we have safer alternatives, that's why we can afford to take a pause. We can afford to say, we're going to stop, and we're going to figure out what's going on before we decide whether to open it up again for other people. And I honestly don't know what they're going to find. And it's going to be very interesting to see.
And I'll bring up this as kind of a Stein remark, but I think it brings up a good point. It says, I'm sure they wouldn't tell us if it was connected.
Yeah, they would. No, they would.
Yeah.
At this point, there's no reason to hide anything. And that, like I said, because we have alternatives. If we can't give people J&J, who's that bad for? It's not bad for me. It's not bad for you. It's not bad for people in our population. It's bad for Johnson & Johnson, right?
Right.
And the government's already bought that vaccine. So, there's really no compelling interest not to tell people the truth with this. And so I think we got to wait and see. But the other question is how much does it erode your confidence in the vaccine? We had a lot of people waiting for J&J for a variety of reasons. And, that may not be an option for them. And so I would say to you, if you were waiting for J&J, we got plenty of Pfizer and Moderna. Come on in, we'll get you today. And so it's we just are going to have to wait and see how this plays out.
And then you said something before, and I want folks to understand what you really mean by this, is that you said that these aren't approved yet.
Right.
We should point out it's emergency authorization on these. It's not the normal approval process where it becomes the regular. Where do we go now on the process on these vaccines? Do they still need to go through a process of another round of approvals, or is it kind of we're getting folks vaccinated? We're seeing this is kind of our own clinical trial taking place on a mass scale, and from that being able to just say, all right, here's their data from the mass, how many people have been vaccinated. These are the side effects. And then we like to move forward for this is the approved, I guess, should be, lifting that emergency authorization off and becoming just approved.
Right. So it's an emergency authorization based on the fact that we're operating under a state of emergency in the United States with regard to COVID. And so the federal government can just, based on its own decision, say we're going to approve it for a period of time. But in order to get full approval, they are going to have to go through all of the steps. So the laws and rules regarding use of any type of drug or agent haven't gone away. They're still there. Keep in mind, though, that clinical trials of these vaccines are still ongoing. So there's going to be plenty of data to give to the FDA to satisfy them. In addition, and this is something that's very unusual, so they're going to have all their clinical studies, and the amount of data from their clinical studies is going to be this much. And then they'll say, see, it's effective, it works. And then they're going to go, and by the way, we have data in this many people, So it's going to be a little bit of both. And I think as time goes on, at least with the RNA vaccines, I would not be surprised if they get approved for regular use.
Gotcha. Teresa Vinsel has this question: have treatment options improved with the infection? We've talked about this several times.
Yeah.
One of the things that's happened too is how to battle COVID once someone's been diagnosed with it, particularly when they make the hospital.
Yeah. Yeah. So the answer is yes, and we continue to see incremental change. We were giving antibodies to people with COVID before they got hospitalized. That was an IV formulation, and now just recently, in the past month, they've come out with an IM formulation. So what that means, instead of having to go to the hospital and get hours of an infusion, you can literally get a shot in your butt, and you'll get antibodies to help fight a mild to moderate COVID infection. So that's one step forward. We still have remdesivir, which is an antiviral, which we've learned that we need to use as early as we can. We use it in conjunction with steroids as soon as people have any problems with their breathing. We've learned to use high flow O2 to make sure people get oxygenated well. We've learned not to put people on a ventilator early. We've learned not to give them lots of IV fluids, because the damage that COVID does, it means that the fluids all leak out in the lung. We've learned to do what's called prone people. So for someone like me, that's wonderful. What that means is you sleep on your stomach. And so it's like, yeah, that's the way I sleep. For people who sleep on your back, well, you're going to have to learn to sleep on your stomach while you're sick, because that helps keep you from getting sicker. So we've gotten little pieces here and there that the management has gotten a little better, a little better, a little better, a little better. In the meantime, there are clinical studies that are going on right now, looking at various combinations combined with new drugs, new therapies, new immune modulators. And every week or so, there's another piece of data which helps improve our how we take care of people with COVID. So if you get COVID, the death rate in Galveston County for the case is about 1%. About 1% of the people who get COVID that die. The real key is keeping people from getting sick and in the ICU, because once you get in the ICU, you still have about a 40% chance of dying. So it still can be a devastating infection, and we don't have a single pill or a single shot that just takes care of everything. And we've learned that the earlier we get at it, the better we are.
Another question from Stan Van Horn. This is a really good one. He says, I understand boosters are still being looked at, but what are your thoughts on if I get a Moderna vaccine, I'm still going to have to get a Moderna booster, or can I get a Pfizer booster? Curious on your thoughts of how this is going to work. This is the exact conversation you and I had Friday.
Yeah.
I asked you about this, as I said, personally. I said, all right, I had Pfizer, obviously, and they're the ones working on the booster, but how about someone who had the Moderna? Can they get the Pfizer booster? Because they're the ones really talking about doing that. And so Stan has the exact question I asked you about Friday.
Yeah, well, your body doesn't know brand names, and it's not going to look at the logo. And, it's not like, you got to go back to the Mercedes dealer because you got a Mercedes. I think, and this is just my opinion, but I think it's not going to make a difference. And what may actually happen, and this is the way drug companies work, is, Pfizer comes up with a booster. Well, what's Moderna going to do? Moderna is going to do, they're going to come up with their better booster. And, and I promise you, both Pfizer and Moderna are going to be looking for people who got the other brand to show that their booster's better, and so I wouldn't be surprised if the competition drives that, and which will be a good thing, because then we'll have a lot more products and we'll be able to tailor the boosters to the area you are and what the variants are that are floating around.
Yeah, I've got to remember, if folks paid attention early on to the process between Pfizer and Moderna, each week they were trying to one up each other about how effective their vaccine was. I mean, the data kept changing every single week, because they would have another series come out and they would have another release. It was dueling press releases for the longest time, which in the long run works out really well. And poor Johnson & Johnson was sitting there saying, well, we're at 70 and now we're at that. They weren't having the same high numbers with theirs. And so now they have this situation that's going on that's put them on hold. And getting back to that, I think Dr. Fauci had mentioned that he expects to have some answer by Friday and may have some restrictions on that. And again, it is interesting on the Johnson & Johnson. Regina Haley asked this question. It's a really good one too. Do you still need to have a COVID test before a medical procedure if you've been vaccinated? and this one has been coming up a whole lot more, and it came up with another thing I should point out. It's like, for example, my mom is in a care center, and you still have to, even though my wife and I have been vaccinated, we still, when we go Friday for her birthday, happy birthday, Mom, that we go, we're going to have tests done before we go, because it has to be within a certain amount of time.
Right.
Being vaccinated doesn't mean you can't give, or the virus can't spread from you, just shed as from you to somebody else. And so can we explain why there's still a testing procedure as well as the vaccination procedure?
Yeah, well, I guess there are two questions. Is that if I've been fully vaccinated, do I have to get a COVID test? The answer is yes. Why? Because that's our policies and procedures. But the real question is, should you have to? And the answer is we don't know yet. More and more, the data is suggesting that maybe not. For example, we just looked at the number of people who got COVID after being fully vaccinated, and in Galveston, we counted 10. Okay, 10 out of hundreds and hundreds of thousands of people. So it's a very, very uncommon event. Yet there are cases where the CDC looked at healthcare workers, and they found that it was only effective in preventing infection about 90% of the time. So what that means is that 10% of the people are at risk for getting the infection, and it also means that that some of them are going to be asymptomatic spreaders. Not all, not even most. Only about 10% of those will be asymptomatic spreaders. So you think about it. You got 200,000 people. 10% of those, maybe the vaccine's not as effective as, that's 20,000 people, and about 2,000 of them may be an asymptomatic spreader. That's a lot of asymptomatic spreaders. And so, so that's why everyone's being very, very cautious about saying, let's stop masking and let's stop the testing. And I would not be surprised to see if this continues to go on. I wouldn't be surprised as cruises open up, they're going to require you to be vaccinated and to get a test before you get on board that ship. And we're going to see similar types of things as we move forward until we have enough confidence that these vaccines work so well that we can abandon those measures.
And here's another really good question here from Hiram Duncan. What if someone got a J&J jab? Can they get a Pfizer Moderna booster?
Boy, that's a really good question. And that
one's a little different than say Pfizer or Moderna, because it's two different technologies.
Right. So they are two different technologies, but remember, what we're doing is we are manipulating the immune system. So no matter what you got, your body's going to remember the commonalities of the COVID vaccine, the things that you're trying to develop antibodies to. It's going to remember those. Now, is it going to be enough that if you got a J&J, that if we use a different technology, that it'll give you enough of a boost? We honestly don't know. I suspect it will be, but we honestly don't know. So what you can expect to see when people talk about boosters, you're going to see, we boosted people and it worked because of, X number of people had a good response. And then you're going to see the breakdown. People who got Pfizer to begin with got the Pfizer booster. People who got Moderna got the Moderna booster. People got J&J got the Pfizer booster. Every different combination. And then the statisticians are all going to sit there and look at it with microscopes and magnifying glasses. And you're going to hear a lot of answers to questions that say, well, in this particular case, it seems to be okay, but in that one, I'm not sure. And that's just the nature of this. We are operating in such a level of uncertainty. It's unprecedented.
Yeah. And poor Regina, she when we answered the surgical story, she really didn't want to hear that answer.
It's not my decision; it's the hospital's decision.
But let me ask this though, I because this is coming up too. I have somewhat grown used to the up the nose and really digging in there. I'm able now to, because I get it tested so often, because I always come across people and I always just want to be sure. To the point I'm able to, I think, grade the best at doing that without jabbing my brain. But how about the other tests are not as evasive? Are they still, are they as inaccurate as we're hearing with the false positives? Or do you think, I know you always recommend, let's go ahead and get the full deal, but would that be okay just to satisfy the needs, you think?
Oh, of course. But you have to interpret it within what it tells you, So the best test still is the PCR test. Mm-hmm. Now, my wife and I did some traveling in February, and in order to get back in the country, we had to get a test, and they used an antigen test. But it was still, trust me, it was well behind my eyeballs. But it really depends on the particular test. There are some where you can swab both nares right here without going in very deeply, but that gives you about 75% of what the really deep test would do. So what does that mean? That means that there's a chance that if you have it, it might not detect it, but there's also a chance, if you're at low risk, that it might tell you you've got it when you don't. And so we just have to accept that. We're going to be seeing more point of care testing, more rapid testing, as people want to get, back to being out and about. If people want to get back to travel and getting on airplanes and getting on cruise ships and trains and big events, we're going to see more point of care testing. So that's just the way it's going to be. The nice thing is, if we can get enough people vaccinated, then the rate of those bad results will be less and less, because we'll know that you've been vaccinated, you have no symptoms, that this is probably a bad test. But right now we have no way of knowing that.
Yeah. In fact, I had gotten a false positive at one time, went back and got the PCR, and it cleared me. Satisfied. It was worth the pain at that point. Going back to David King, who had before, he's the one who had made the comment about trusting they would tell him. He says he is concerned, however, because he talks about the mixed messaging that had come out before. We've talked about that several times. And that's the tough thing when dealing with something that in itself we've never dealt with before. So one day it's thought about one thing, then the next week after some more data. It all is dependent on the data and really listening to what's happening now. Something may have been said in February of 2020 about how to deal with it that really is not accurate now in April of 2021. I wonder if we could talk about that some, because to put people's minds in it, that this is an ever evolving process. We don't know what we don't know in many ways. And yes, there's been some statements said, and masking being one of them. But context, the advice at the time was, well, we don't think we need to mask. But when you go back and you listen to the reasoning for that was, well, we didn't want masks to be taken away where we really needed them. But now that they're more readily available and the like. But you do understand, we've talked about this, the concern people have about they hear one message and then later they hear a different message.
The question is, who do you trust? And, it's I've experienced this in my own family, where I have family members I haven't seen in a while, and we're talking. And, whereas we, because of our professions, we're out and we're engaged, and it's, we see what's going on. And it's not like some people who have just been hiding in their homes, and then they hear, everything on TV, and one family member listens to Fox and the other one listens to MSNBC, and you're hearing all these different kind of things, and they go, we don't know who to believe, and it's a panic. And I say, well, you can trust me. And you know what? They're not sure they can trust me because they've heard so many different things. I got to tell you, we as public health officials screwed up early on. And where we screwed up was in one area, telling people that, trying to calm people's fears. And I don't know how many times I heard, well, based on what we know from other coronaviruses, this is the way it will be. And it was just 100% wrong. And I sat on conference calls where I'm cringing just hearing that. And then I think a real example is the masking issue. You know, we sent out the wrong message. It wasn't that masking doesn't help you. It was that we need those N95 masks for our doctors and nurses. So please don't use them because we need them for them. That's what we should have told people. And go ahead, make your own mask. It's okay to wear a mask. And then suddenly things changed, and then we had a very contentious presidential election. And if you go back and you look at some of the things politicians have said on both sides, you can tell that they were using things like that to try and bolster their chances of getting reelected. And I think that that just helped create a lot of confusion. And so, so now we're in a bad spot, and that we've got a group of people who don't necessarily trust what public health officials and other people are telling them, and we've got to win their trust again. And so, from my point of view, I'm just trying to be as honest, as open as possible, and tell people what I know and what I don't know, and encourage people that it's going to be okay. And right now, I think getting the vaccine is going to be okay, and so people should do it.
Yeah, and it goes into one too. I think if anybody's watched these shows that we've done every week, and you and I have talked about this, so folks, we talk before we get on the show. I mean, he and I, Dr. Keiser and I spoke Friday, and then again a little bit before we came on the air today, and so that we both are kind of in context of what is being said and the questions that I'm getting from viewers beforehand than the questions we get when we're live here. These questions, he doesn't see these questions before, and nor do I, before they pop up on the screen. But I think we've been pretty consistent about, we know what we know at the time. And we try to put that out, which brings me to kind of our hospitals in the county is still at high capacity. How are we doing on bed wise?
Very well.
As far as that.
Yeah, we're doing very well. We've got, in terms of county residents in the hospital, we have less than 40 in terms of just hospitals in the UTMB system. We have a little, not quite 50 people as of this morning. Remember, we topped out in the 120, 130 people in the hospital. So, the numbers continue to dwindle, and that's a very good thing. Also, keep in mind that many of these people in the hospital have been in the hospital for months. Mm-hmm. So these don't represent new infections. These just represent people that have been very, very sick for a very, very long time.
Yeah, and then when they have those underlying conditions, too, that they're battling that have been exacerbated by COVID-19, it makes it a little more difficult, and it's not. For some, it's not a short-term process. As I said, big news coming out of this today was Galveston County is going to be closing down Walter Hall Park as a vaccination clinic. Right now, it's already not going to be used for first shots any longer, just for second shots. The last event will be May 1st, and now the system changes up some for that. So just a reminder to folks there. I know a lot of folks are glad to have the park back as a park instead of a vaccination area to go along the way. So that news coming out today. Again, we'll be back on. Now, I do want to point out, now you and I talked about that. We'll see how this goes because as we said at the top of the show, Dr. Keiser is now also the interim head of the Galveston County Health District and also chair of the for the Coastal Health and Wellness, which is the nonprofit health clinic for the county as well. And while the priority is still going to be COVID-19 in many ways, we got other healthcare issues to deal with. And as I jokingly told Dr. Keiser Friday, I will let our viewers know this. I said, you're a glutton for punishment. It's not like you were busy enough as it was. But he's taking this role on right now with the retirement of Kathy Barrasso. And she's still there right now. You guys are in kind of a transition process.
Oh, yeah. So are today.
And I should have put out Heidi Gordon just asked us this because I just reiterated she missed this earlier. Where they're going to be vaccinated, Heidi, what it's going to do is mainly move now to community-based clinics, and the health district as well as UTMB are going to start working with other folks in partnership to make these available. But it's really kind of a move away from the mass vaccination sites to more kind of community-oriented sites, correct?
Yes, that's correct.
That's it. All right. Dr. Philip Keiser, the local health authority, on with us from Galveston County. As always, thanks. We appreciate it, folks. We'll be on again next week. As I said, we're going to play this a little more by ear now than we did before, and it may adjust days. We'll try to give you enough of a heads up, I should say, before we do so, make a switch so that we know the availability for Dr. Keiser's time at that. And, hey, look, you got a member of the fan club saying thank you for all your hard work through the crisis from Heidi Gordon there. That's a good one to have there. So good on the out cue here. And yes, folks, you did hear a piano key go off at one point there. I get a little background. Dr. Keiser is sitting at his wife's piano and he leaned forward and hit the keys there. So that's good. I've been trying to get him to do this just so folks understand. He's a wonderful musician. He's good guitar player. You can play chopsticks. There you go. That's it. I can't get you to play the guitar, but I can get you to play chopsticks on that. He's a very good guitarist. So one day we're going to have him entertain us for that.
Okay, all right.
Well, so great. Dr. Philip Keiser has been on with us. Our coverage of COVID-19 issues in Galveston County. And keep watching here on I-45 now.